May 21st. We have fiscal year 25 Q2 hospital financials year to date review with Matthew Sutter. Before that, we have the meeting minutes from April 30th, which I move to approve.
Second.
All in favor say aye.
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 Aye. Minutes are approved, and I'll turn it to Mr. Sutter.
Thank you, Chair Foster. Let me get these slides showing. All right, can everyone see the slide deck?
Yes.
Great. So thank everyone for attending. This is going to be a fairly quick presentation. Just given the state of the health system in Vermont, we thought it was timely to give an update once we had about half the year's actuals in. So that's what we'll do. I'll start with a quick overview of where they ended in FY23, FY24, looking to days cash on hand as like a liquidity measure and operating margin, just to kind of set the stage for each hospital's performance year to date this year. Then we'll run through some individual slides, looking at some real high level financial ratios and like a profit and loss statement, a summary profit and loss statement. After that, Emma Runya is actually going to run through some visit lag slides for us right at the end. So just a little bit different than the finances, but we did want to report on some of those requirements. Or take this opportunity to share those publicly as well. So beginning with some background, here you'll see operating margin and days cash on hand for the 14 community hospitals. We showed FY23 and FY24 and just an arrow to kind of characterize the trend from FY23 to 24. Don't read into that too much. We just try to make it visually easier to see where hospitals are landing, or kind of the trend from 23 to 24. I did want to note, of course, when you look at a presentation right before you present, you find errors. I made a quick update to this slide right before we went live, but the one on the website is not updated yet. Relatively minor. Just North Country we had characterized as their operating margin trend is a down arrow. It's actually an up arrow, even though it's negative 2.5 in FY24. It's an improvement over 23. So we'll get that fixed on the website. But if anyone caught that, that's my error. So, forgive me, went too far. All right, beginning with Brattleboro. If we see, I'll start and say this is probably the most concerning numbers you'll see today. Looking at their days cash on hand, we started at about 100 at the end of FY24. It's now diminished to about 84 days. And perhaps more jarring is their days in accounts receivable sitting at around 100. I can tell you, I don't think there's any, other than Springfield, I don't believe there's any hospital in the state that has days accounts receivable higher than 60. So this is an anomaly and very, very high. You can also see year to date, they have a negative almost 14% operating margin, a slight improvement from Q1, but a significant drop from FY24, which was already at negative 5%. So on each of these slides, we'll have some bullet points, just kind of provide some narrative context for their submissions, but they're fairly high level. So Brattleboro, you'll see, if I could go back, my apologies. I did want to just explain kind of how to interpret the bottom slide, the P&L. So since it's Q2, we're 50% through the year, and then the percentage to the right of that is just showing how much of their budget they've actually spent year to date. Obviously, there's seasonality with hospital budgets. With the exception of the health network, we don't have monthly budgets for the hospitals. So we want to do some more sophisticated analysis next year. Now we're getting monthly actuals from the hospitals, but just to kind of give you some context for how they're coming in relative to the amount of time elapsed during the year, we include that column. So you see, just to interpret the slide for you, Brattleboro's received about 47% of their budgeted NPR, but have spent 54% of their budgeted operating expenses through the year. So like I said, NPR is at 47% of annual budget. Commercial NPR is a little bit closer to expectation at almost 50%. Salaries are over budget for the year, but they've initiated a hiring freeze, and non-labor expenses over budget driven by consulting, travelers, and infusion drugs. They did in their most recent narrative submission, they mentioned a full financial recovery plan for the remainder of the year that we should start seeing in their actuals moving forward. Moving to CVMC, You can see their days cash sitting at around 70, accounts receivable at around 42. Here they have a little bit of an operating margin loss for the year, but on the next slide, I think we can explain that. Like I mentioned previously, very quickly, the Health Network does budget monthly and are adapted. You can see they budgeted really losses through Q2 of $1.5 million. So they're actually, relative to that, a little bit favorable, even though they're have an operating loss year to date. And again, this kind of probably touches on some seasonal aspects of their budget. So commercial NPR is $4.2 million over, driven by inpatient and outpatient volume. Salaries inclusive of travelers are also over budget by almost $3 million, and non-labor expenses are over budget year to date by $3.2 million as well. Moving to Copley, you can see kind of a continuation of where you saw FY24 land. They're with like about a 1.5% operating margin and days cash on hand sitting, we would want it to be higher, but sitting at fairly stable at around 60 days. NPR is exceeding budget by 1.5% or just under $1 million due to outpatient utilization. They are seeing commercial over by 3.6 million, which is offsetting Medicare and Medicaid, which have come in under. Operating expenses also are exceeding budget by about 2.5%. But like I mentioned before, their performance, real high levels, about on par, I would say, with last year. We're also seeing some challenging figures coming out of Gifford. As you'll recall, their FY24 operating margin was very poor, negative 18%, I'm showing here. And year to date, we're seeing improvement to that, but continued losses. So they're at 6.3% negative operating margin through the second quarter of the year. We haven't received a narrative from Gifford since November, but their operating expenses are running over budget and revenue is running below, contributing to large sustained losses. Grace Cottage, you'll see they also have kind of worrying negative operating margins. Grace is a little unusual in that they do rely on community donations to offset some budgeted losses year to year, but what we're seeing, their operating results year to date that's not going to cover it. So we did hear from Grace Cottage that their figures are improving. They received an added interim rate change from Medicare. I'm blanking on the month. I apologize for that. That's going to have a beneficial impact on their budget. Year to date expenses are roughly 5% over, but patient care revenue is a little bit under Grace. Mount Scottney, you'll see very healthy days cash on hand or liquidity there, and their operating margin is about break even, just under year to date. From what we've heard from them, they're projecting that's about how the year will end there. But volume overages and inpatient acute ER hospital-based provider encounters are offset by low swing rehab and physician revenues. They're reporting a methodology change in 340B revenues, which is creating an overage in other revenue. And a continued theme and narratives of salaries being over budget, under budget, offset by contract labor being over budget. Moving ahead to North Country, you'll see they're relatively healthy days cash on hand, but it's fallen since the end of 24 from about 200 to 180 days. Their operating margins about break even year to date. So gross patient revenue is under budget 3.8% or $5.6 million. Seeing utilization coming in under budget. A large driver of which is surgical services. There's an additional $1.2 million in revenue from a cost report settlement from prior years, and expenses are about 2% over due to high health insurance costs, EMR legal expenses, and additional consulting expenses. North Country is projecting a similar, I think, result for the end of the year, just 30,000 operating profit. So it looks like they're just trying to break even for the year. That's what it is. NVRH, you're seeing 90 days cash on hand, down from about 100 at the end of FY24. Their operating margins year to date about 3% negative. They barely broke even in 24, so kind of concerning there, but an improvement over quarter one. They had 5.4% negative operating margin then. Gross patient revenues close to expectations. However, NPR and FPPs coming in a little bit under. So adjustments coming in hotter than budget as well. Expenses are over, the largest contributor of which appears to be non-salary. At Northwestern Medical Center, so we are only showing days cash and days accounts receivable through Q1 for them. We haven't received when we were building this, at least we haven't received a updated balance sheet from Northwestern, but as you can see from 24, 25, they have extremely high days cash on hand at Northwestern. So minimal liquidity concerns, but you're seeing, again, negative operating margins out of Northwestern, negative 2%, which is kind of in line with where they landed in FY24. Volumes appear to be down in inpatient, outpatient, and swing. But NPR is coming in around budget, 49.5% of what they budgeted this year. Again, bearing in mind that there's some seasonality there, and you shouldn't expect, exactly half of your NPR halfway through the year. You shouldn't necessarily expect that. Porter Medical Center, again, kind of continued trends from last year. You're seeing some diminished days cash on hand. It's fallen from about 118 to 102 is what we're showing now, but positive operating margins out of Porter. And forgive me if I neglected to explain it on the CDMC slide. For the health network hospitals, since we do have monthly budgeted figures in our database, we can show above how they're running above or below what their budgeted expectations are. So we'd like to be able to do this for all the hospitals moving forward. The data is just not there yet, but so you can see at Porter, their other operating revenues significantly over budget. Meanwhile, NPR, FEPs about 2% over. They're seeing higher than expected volumes in inpatient as well as OR, ER, radiology, and lab. Labor expenses coming in about 2.5% or $1 million over. Travelers remaining a challenge there. Non-labor expenses, we're seeing overages, including supplies and pharmaceuticals, and the margins coming in higher than budgeted. So solid financial performance year to date out of Porter, despite struggling with FTE shortages and the corresponding traveler costs. Rutland continues to have very healthy days cash on hand, low accounts receivable. Their margins improved. It was just under 1% last year. Now it's at about 3.6% year to date. And just looking at how figures are coming in relative to budget, we're seeing kind of in line with expectations. Gross revenue is falling below budget by 6.9%, but NPR is about just under expectation at 0.1. Other operating incomes, $2.5 million, favorable from Rutland's perspective, driven by retail and 340B revenue due to a retroactive payment. Expenses are under budget at Rutland due to a positive FTE variance, and this is somewhat offset by higher than anticipated supplies. Rutland's also been able to reduce custodial day volume, which has been a positive offset to lower than expected volumes. At SVMC, I do want to, every presentation we get the same caveat, but SVMC's days cash always looks lower than it actually is. Their parent organization, I think, holds a lot of the cash for them. So despite those what appear to be very low days cash, it's that has to be taken into context with Southwestern. You're seeing similar results at the close of FY24. They're at negative, almost break even operating margin, which is where they landed in FY24. NPR is a little lower than budget year to date by 1% due to lower than anticipated inpatient volume, higher than expected bad debt and free care. Expenses are generally on budget with the exception of pharmacy and purchase services related to 340B. SVMC continues to practice expense management, especially with regard to labor. And they were able to provide us projections for this presentation. Moving to Springfield, we're seeing some concerning numbers out of there. If you look at their days cash on hand, Springfield is not a very liquid hospital. They ended FY24 with about 43 days cash. They're sitting about 38 now and a negative 2.4% operating margin. Yeah, just concerning. Volumes have exceeded budget year to date. But bad debt and free care are coming in higher than expected. Labor expense and travelers are an ongoing challenge for the hospital. And they lost a general surgeon, but have since been able to hire 2 full-time surgeons. In Springfield's most recent narrative, they spoke to increasing wages for labor recruitment and drivers of that negative operating margin, again, being that bad debt, free care, and lower NPR from a lower charge increase and higher than budgeted expenses. And moving to UVM. UVM's days cash is sitting about 126 days. Days accounts receivable is very similar to how they ended 24 at around 50 days. And they're running a small operating margin of 1.3% year to date. NPR FUP is 3.8% favorable against their budget year to date, driven by favorable payer mix, volume, and cost report. Commercial NPR less Medicare Advantage is over nearly 6% compared to year-to-date budget. And they told us the Blue Cross Blue Shield settlement is reflected in reporting in March of 2025. Salaries, fringe, and travel expense have been slightly over. Retail and pharmaceutical, as well as med surge expense, are consistent drivers of these non-labor overages at UVM. Their narrative spoke to high demand in inpatient, outpatient, and professional services, as well as a favorable payer mix. And I will pass it along to Emma to kind of go over the referral and visit lags.
Hey, thanks, Matt. So I'm just going to quickly go over this. There's not a lot of data here, but we did want to flag it. This is coming from a requirement in the budget orders from last year. All the hospitals were required to submit referral and visit lag data to us on April 30th for the months of February and March. So far we've gotten data from 8 hospitals. Of the 6 hospitals that we haven't gotten data from, we are in contact with some of them, so we do know that there should be more data coming in. But as of Monday, these are the data. These are the hospitals that we have data for. And then I also, specifically to the referral lags, just want to point out that Grace doesn't take referrals, so that's why they don't have data here. And Springfield didn't provide referral for imaging, but did for specialty practices. And then I also, before I get into it, just want to note that this is different from our requirement and guidance asking for visit and referral lag data. That's for a 2-week period, and so we'll be getting that with their budget submissions in July. And that's what we'll be comparing to last year's, because we had that requirement both years. This is a new requirement for us that we haven't asked hospitals for before, so we don't have anything to compare to prior. But the numbers, like you're saying, may change and may be a little different, likely will be different in the summer because it's a different time period. So looking at referral lags, sorry, Matt, I just wanted to point out that North Country is actually at 100% for their imaging procedures of percentage of appointments scheduled within 3 business days of referral, which is really great. We see this number ranges from 19% at Mount Ascutney to 100% at North Country. And a similar stat for specialty practices ranges from 39% at UVM to 74% at Mount Ascutney. And again, this is just scheduling the appointment within 3 business days. Looking at their visit lags for imaging, I do want to note here that for Grace and North Country, I shouldn't have put NA, should have put something else, but they did provide us with the number of imaging procedures done. They just didn't give us the wait times and or the scheduling times for that. So that's why they don't have data in this one. But looking at the middle 2 columns, so the percentage of patients seen within 14 days and the percentage of patients seen within 15 to 30 days, essentially a month. If we're looking at that across the hospitals that have submitted data to us, they're all at least 80%. So that's 80% at UVM up to 95% at Porter. So the vast majority of patients are being seen for imaging procedures within 30 days, a little bit more within 31 to 90 days. And we're seeing very few being scheduled more than 3 months out. And finally, for specialty practices, I just want to note here that this obviously varies hospital by hospital. So which specialties that they include in their reporting, as well as just which specialties that they provide, are obviously different across these hospitals, but aggregating them and looking at them at a high level. Again, looking at that far right column, the percentage of patients seen within 3 to 6 months, definitely higher for specialty practices compared to imaging, which is what we would expect to see. But this does range very widely from 0% at Mount Ascutney. So everyone at Mount Ascutney for this time period was seen within 3 months, whereas at Grace Cottage, that number is at 56%. And then again, looking at that percentage of patients seen within a month, this ranges more widely also than the imaging procedures. So 25% at Grace Cottage up to 87% at Springfield. And so overall, I think we would just say that in aggregate, we're not seeing any huge changes from previous data that we've collected. Nothing seems to be getting a lot better or a lot worse. Obviously, when you drill down into the specialties by hospital, you can see a little bit more nuanced data, but overall, in the general scheme of things, there's not major changes from previous data we've collected.
Thanks, Emma. So that's what we have for you today. Apologies for the data dump. I know it kind of feels that way. We just thought it was important for everybody to kind of be on the same page with the financial figures that we're seeing. But I'll pass it back to you, Chair Foster.
Thank you, Matt and Emma, and I'm really glad that you did this year. So thanks for thinking of it. Board member questions or comments?
Just one observation. I'm just curious. It seems that certain hospitals have quite a bit more non-operating revenue than others, at least as a percentage of their total operating revenue. Looking at this, it seems that some of those hospitals are hospitals that have large days cash on hand. I assume they're making gains on their investments, which is leading to non-operating revenue gains so that they can cover their operating losses with not operating gains. Is that fair to say? Does that seem to be a trend? Are there some exceptions to that trend?
It's a little hard to say because you in the non-operating revenue you'll have unrealized gains and like midway through they don't know where their year is going to end at. I think some hospitals have a hard time budgeting non-operating revenues for that reason. I will say that there's a discrepancy in the amount of other operating revenue between the hospitals. So that non-NPR revenue, there's pretty wide variance in how percentage of total operating revenue that hospitals generate from non-NPR sources.
And what are some of the things that can be categorized as that non-NPR?
Yeah, 340B is a big one. Specialty pharmacy can be, I think, hundreds of millions at UVM. So those things are bucketed as other operating revenues. So they don't fall under net patient revenue.
Okay. And then what about a hospital like SVMC whose days cash on hand is held by a parent company? I assume then the parent company is making the investment gains so that I assume cash is being shifted from the hospital level to the parent company. Investment gains are made at the parent company. Does that reflect back into the operating income at any point?
It could, but I don't want to characterize a specific budget like a hospital that way. I wouldn't feel comfortable unless I actually look at their finances to characterize it one way or another. Dave, sorry.
Okay. Thanks for the presentation.
Matt, just a quick question, but thank you so much to both you and Emma for the presentation and the update. Troubling as we continue to see. Just a quick question. I know every time we present or you present or anybody presents SVMC, there's a conversation around the parent company. I'm just wondering, can we just asterisk that or put in parentheses what the parent days cash on hand is? Because it would be helpful to know actually what the parent, days cash on hand is. So that'd be just a standard way of presenting it in the future, if that's possible.
Yeah, I'd love to do that. I think we can get it from audited financials. We should be able to generate that. Yeah.
Matt,
I see your hands up.
I think it's on the note in the presentation.
Oh, did I miss it? I'm sorry. Thank you,
no,
Janelle.
I just put it as like a side note because we did ask them for that.
Janelle, I apologize. I stripped all the notes out before we present.
Oh,
so they wouldn't accidentally show. I'm sorry.
Okay, but just that's no problem. I'm just thinking in the future, just because it would be helpful for us to understand, what is possible at the parent corporation. So thank you.
Definitely. No, we absolutely should do that. Thank you, Jess.
Any comment or questions from the healthcare advocate?
Good afternoon. Nothing really substantive at this stage beyond just to thank Matt, Emma, and Janelle for this presentation and for all the hard work putting it together. So thank you.
Thank you, Sam. And public comment via raise the hand. Alex, how are you?
Today's not a good day. I will be very honest about that. I have 7 questions actually. When were you gonna know who the 5th member is, and when is that getting announced? First one. Second one is related to the rate increases. People are gonna go bankrupt or they're gonna go uninsured and hope that nothing happens health-wise, which is so sad to say. Sorry, I'm gonna use my language carefully. How much money has the health network at UVM provided to the New York hospitals for fiscal year 25? I want to know that, and the public should know that too. Third one, I listened to the UVM person yesterday testifying about the Medicare rates. I agree, they're very low. They are so low for PT that the allowed amount isn't even essentially the Medicare rate allowed amount based on what my PT's bill. For some of the Advantage plans, their $55 copay, which typically is half of the allowed amount, if we don't use certain codes or they don't bill certain codes, the $55 copay is basically, it's not $55, it's less than that. And this sucks. I can't believe I'm saying this. In order to afford a business plan premium next year, we are faced with potentially, and I don't want to do this, dropping the VA, Medicaid, and Medicare in order to afford a healthcare plan for our employees. I can't believe I just said that. It's so infuriating. Next one, again, from the testimony yesterday about capping the drug pricing at the hospitals. A majority of the money will help Blue Cross of Vermont for sure. The person also said that it would also benefit the out-of-state Blue plans. Again, not everyone has a Blue Cross of Vermont plan, including some of the large employers in the state who would also benefit. And then on the presentation, why is the UVM accounts receivable amount going up and what's the dollar amount? And lastly, I am again requesting a meeting with the DFR. The email that I sent to the person that I was given is no longer active. Let's just say there's some really weird stuff going on and I need to talk to someone about it because this is not acceptable. Thank you.
I'm trying to address some of those. Some I don't think I have answers for, but I try to keep track. New board member, we have nothing to do with that. We have no say, we have no input. So the appropriate people to inquire with would be the governor's office or the nominating committee. Although having been through that process, my understanding it is very confidential because people have jobs and careers, and so that's a confidential process. I don't know the timing myself. Rate increases. It will provide you no solace to say that we're immensely concerned ourselves. It's a contested case. That process is going on. We'll have decisions in August. Money to New York from UVM for fiscal year 25. I don't believe we currently have that number. I think the last number I heard was the outstanding debt was up to around $93 million. Whether or not that's been paid back or added to, I do not know. Drug pricing out of states. I testified this morning on that bill. I do think it's concerning, regardless of whether or not the savings accrue to out-of-state plans or in-state plans. The patient pays copays. Depending on the deductible, that can matter to families. Assets receivable, why it's up, this would be a better question for UVM that I don't know off the top of my head. And in terms of DFR contacts, they're an independent part of the administration, not us. I would suggest you just go on their website. There's probably a contact there. But I don't have one myself. But thank you for your comment, Alex.
Thank you.
Any other comments? Okay. Matt and Emma, thank you for doing this, and I may have follow-up separately on some of the information because it concerns some of the transformation and what we're going to do about the state is going to do about these trend lines, which are difficult. I think we have nothing else on the agenda, so unless there's any new or old business, I will move to adjourn.
Second.
All in favor, say aye.
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 Aye. We are adjourned. Have a good day.